Welcome to my video presentation on sotalol hydrochloride. My student ID is U3275356 and I hope you enjoy. So what is sotalol hydrochloride? This is a beta blocker that affects both the heart and the other parts of the body. It slows down the electrical signals in the heart, making the atria, ventricles, and bypass pathways take longer to rest between beats. It doesn't activate the sympathetic nervous system or stabilize cell membranes at typical doses. This medication is used to treat and prevent irregular heartbeats, such as those in upper chambers, above the ventricles, and in the lower chambers of the heart. What is sotalol hydrochloride prescribed for? Sotalol hydrochloride is used to treat certain types of serious life-threatening ventricular arrhythmias. Sotalol hydrochloride is also used to treat people who currently have normal heart rhythm but have had symptoms of atrial fibrillation or even atrial flutter in the past. The pharmacodynamics of sotalol hydrochloride. It is a beta blocker that helps control abnormal heart rhythms by blocking certain heart receptors. It is well absorbed by the body with nearly 100% bioavailability when taken without food. It reaches peak levels in the blood 2 to 3 hours after taking it and has a half-life of 7 to 15 hours. Because the kidney clears most of the drug, its dosage needs to be adjusted for patients with kidney issues or during pregnancy. Sotalol's impact on heart function depends on its concentration in the blood. It can increase the strength of the heart contractions in specific tissues, especially at lower heart rates, but generally does not significantly depress overall heart function. It typically lowers the heart rate without greatly changing blood pressure, even in people with weakened heart function. Pharmacokinetics of sotalol hydrochloride. Absorption. It is almost fully absorbed when taken orally and does not go through significant first-pass liver metabolism, giving it an absolute bioavailability of 90 to 100%. Peak blood levels are achieved 2 to 4 hours after an oral dose. Taking sotalol with food decreases its bioavailability about 20%. Metabolism. Sotalol hydrochloride is not metabolized by the body. Around 80 to 90% of the dose is excreted unchanged in the urine, while a small amount is eliminated unchanged in the feces. In healthy individuals, its elimination half-life ranges from 10 to 20 hours. Distribution. Peak plasma concentrations of 1.4 to 1.7 mg per liter are reached at 2 to 3 hours after a 160 mg oral dose. Total apparent volume of distribution of sotalol ranges from 1.6 to 2.4 liters per kg. Elimination. Following oral administration, approximately 75% of the dose is excreted unchanged in the urine within 72 hours, while less than 10% is eliminated through the feces. The average elimination half-life of sotalol hydrochloride is 12.7 to 1.6 hours, with a plasma half-life of around 15 hours. This medicine is available from a pharmacist and requires a prescription from your doctor. It is a Schedule IV prescription-only medicine, which means they can be only prescribed by a GP or another suitably qualified healthcare professional. This medicine was also verified as being available on the PBS, which is the Pharmaceutical Benefit Scheme, on September 1st, 2024. People who are taking beta blockers such as sotalol hydrochloride should avoid eating potassium supplements or fruits like bananas, as the beta blockers decrease the uptake of potassium from the blood into the cells, leading to excess potassium in the blood, a potentially dangerous condition known as hyperkalemia. Some counseling considerations. How to take sotalol hydrochloride. You may take it with or without food, but it is important to choose one way and take it the same way with each dose. If you miss a dose of the medicine, it can be taken as soon as you remember, but don't take it if the next dose is under 6 hours, as doubling up on the doses can lower the blood pressure. Some side effects of taking sotalol hydrochloride include feeling tired, sick, or dizzy, having diarrhea or a headache, and sometimes it may also make you feel dizzy while you're waking up. These are usually mild and short-lived. If you use antacids containing aluminium or magnesium, do not take them at the same time as sotalol. These antacids can bind to sotalol and decrease its absorption and effectiveness. Some physiological effects of sotalol on a humanoid looks like headache, blue lips, chest pain, trouble urinating, blue fingernails, diarrhea, skin rash, back pain, fever, dizziness, and more. Test your knowledge with the following questions on sotalol hydrochloride. Can you take potassium supplements with sotalol hydrochloride? What schedule does sotalol come under? Thank you so much for listening to my presentation.